I want to begin by acknowledging the lands on which we stand, Ngunnawal country, pay my respects to elders past, present and emerging, and to all Aboriginal and Torres Strait Islander people in the room here today. My name is Michelle Bovill. I'm a Wiradjuri woman from Mudgee, New South Wales, and I've grown up on Worimi country in Port Stephens. I completed my PhD at the end of 2018 on smoking in pregnancy with Aboriginal and Torres Strait Islander women in New South Wales, Queensland and South Australia, and you've heard a little bit about that with Gillian's presentation. My research fed into the pilot trial of I Can Quit in Pregnancy and has formed now into an RCT, Sister Quit, and my current funded project by NHMRC and the Heart Foundation, which is called Which Way. And I was very privileged to have the opportunity to yarn with Aboriginal and Torres Strait Islander women across these states and hear their stories. So I wanted to privilege their voices in the discussion today on smoking and pregnancy. So my presentation is a collation of my research to date in the area of smoking and pregnancy and combines the voices of Aboriginal and Torres Strait Islander women from these 4 publications, but also my ongoing dialogue that I have with Aboriginal women and communities. So in 5 minutes, I'm going to tell you 4 things, is my goal. So I want to tell you 2 key clinical findings that I found from my research that should be engaged in this conversation today. So Aboriginal women are making quit attempts during pregnancy. It's very important to highlight this, even though our statistics are saying that it is still high. Yes, it is still high, but we're asking women if they're smoking, yes, no. We're not measuring any kind of reduction. We're not measuring, have you stopped for any period of time during this? And what I found was a lot of our women are actively making ongoing quit attempts. So our motivation is high. And that there is a very real problem with the R word in our settings, where women are being told you could quit or reduce. We need to ensure that we have a clear message to our mothers that if we are measuring quit yes or no, that's the message that we're giving our women, that we should be advising them to quit, but also then, as we've discussed a lot today, is empower our women and offer them support. See, reduction is also being advised in clinical guidelines. So there isn't really a clear message around what clinicians should be providing. But Aboriginal women have told me that, well, doctors should stop telling people to reduce and to cut down. So Aboriginal women, when they're told to reduce, are reducing. We saw in Sandra Eads' first clinical trial that 70% of women, when advised by their doctors to make a quit attempt, they made a quit attempt. So we need to have our messages really nice and clear to our women. But this comes to a bit of a conundrum where, well, what cessation support should we offer our women? And this is the same thing that I have AMSs ask me all the time, well, what should we be doing? What should we be offering our mothers? So when I spoke to Aboriginal women, they have told me a couple key ideas that I want to share with you. Look, we've already heard that systematic reviews have said there's really no effective strategies within this setting. It's important to note that we still have limited trials in this setting, so the data isn't perfect. Aboriginal women spoke to me about wanting support and expecting support from the healthcare providers. It's everyone's business, and we'd already have some really important work addressing that area of need. But what we do really need, what Aboriginal women have told me they really do need, is some good health messaging, which we've just discussed. Women have told me that they see health messages and health promotion. They get their education through TV ads, social media ads and marketing. And we need to ensure that we have a really supportive and empowering message to our mums to quit smoking during pregnancy. But women have also said to me, you know, they keep talking about small babies, but what does that mean? What does it mean if I have a small baby for the long-term health outcomes of that child? And these are really important things that we need to integrate in the messaging that we give our women. And the second thing is we need to develop an evidence base for new and innovative interventions that are built on the interests of Aboriginal people. And so that's what I'm doing. So I've been funded by NHMRC with an Early Career Fellowship and the Heart Foundation, and I have a project called Which Way, which is going out, partnering with 4 Aboriginal communities in New South Wales and asking Aboriginal women, what do you want to support you to quit smoking? Aboriginal women have already told me that they're interested in things like mindfulness and yoga and alternate approaches, not vaping, alternate approaches to smoking cessation. It's already been shown in white populations in the UK that these things can help quit smoking. So maybe it is that our women can't afford to do mindfulness or yoga or things like that to help them quit smoking. Am I done? I'm done?
No.
I've got 1 minute. Okay, so I'm going to do this yarning circles, systematic review of whatever the women are saying they want to see what the evidence base is. I'm looking at doing a national survey of Aboriginal women to see if what our women in New South Wales want feeds across the country, to see if it has relevance across our country, and then offer that in a small RCT trial over the next 4 years. The end.